Welcome to the IDEX Continuing Education Series.
Well, hello and welcome to another presentation in the IDEX Continuing Education Series. Today we're going to talk about fecal testing and with an emphasis on infectious disease testing with that, both parasitology and PCR. So, we're going to have a talk about, well, why do you perform fecal examinations, especially when we're talking about parasitology. Have a look at the methods that are available for it, because there's a lot of variation and they're not all the same, and the accuracy of them is not the same. So it's important that we have an understanding of what are the pros and cons of different techniques. We'll also address what's new in the world of fecal parasitology testing, and then really discuss how that fits in with PCR testing, because often when we're thinking of testing feces for infectious disease, we're thinking fecal cultures, PCR and things like that, or maybe antigen testing like a parvo snap test or something like that. But we've got other things with parasitology that we can do now. So, what are some of the indications for doing fecal testing? And we're talking about parasitology here. And I guess for me, we're probably going to divide it into two groups. There's looking at patients that are unwell. So, a patient with acute or chronic diarrhea, depending on the setting, we may well be doing PCR, but certainly should be looking at parasitology as well in every case. Sometimes we'll consider doing parasitology in patients that have unexplained weight loss, especially younger animals, but doesn't have to just be young ones. Parasitology is very important there. In some patients with anemia, especially if it's a regenerative anemia, more consistent with blood loss, fecal parasitology is important to do, because there are times that we can have things like hookworms or whipworms that may be causing anemia that's very easily managed if we diagnose that. We sometimes also use fecal parasitology in healthy patients. So looking for, doing routine checking to see if there are fecal parasites present, and sometimes patients can have occult infections. So they may have an infection without clinical signs. And so doing, good quality parasitology in that setting is helpful to determine if we need to treat them or not. And then there's the consideration these days of whether, should we be testing before we treat? So, doing parasitology, if they're negative, they don't necessarily need to be treated for intestinal parasites, but if they have a positive result, then we would treat them for that. I guess these are extremes, but, there are potential consequences, if we miss parasitic infections. Things like hookworms, we can get migration with that. Parasites in younger animals especially may cause ill thrift and poor weight gain. With significant burdens in older animals may cause weight loss. We talked before about potential anemia and things like that. And I guess the other thing that we've really got to consider is that there is the zoonotic aspect with it as well. Visceral larval migrants with things like roundworms. We can also get, parasite migration with hookworms. No one wants to wake up and see that foot in the middle picture there. And hookworms can burrow up through the skin. So it has some public health consequence with that as well. So I guess, the question that we've sort of got to ask ourselves is, well, what fecal testing processes do we do today? In some clinics, they're not doing a lot because they're routinely treating, but other clinics will do more testing. What do you talk to your pet owners about with intestinal parasites, to educate them, and what sort of resources are you using for educating your clients? So let's have a run through some of the methods we've got for doing fecal examination. At the simplest end of the scale, we've got things like fecal smears. So, mixing a really fresh fecal sample, it needs to be still warm and steaming, with a bit of saline on a slide and having a look at that. Probably the best thing, it's most useful for looking for giardia, and we're looking for the motile trophozoites with that. So if you see them moving around, we know that we've got giardia there. It's less useful for our more common intestinal worms, so hookworms, roundworms, whipworms. This is not the way to try and detect those. But even for giardia, important to realise that the sensitivity is less than 50%. So it's not saying it's not worth doing. It's a simple test. It's inexpensive to do. And if you're concerned about giardia, it definitely has value. And if we get a positive, it tells us, that that's what they've got. But a negative does not rule out the possibility of giardia. Then I guess we look at things like a simple fecal flotation, so using the sugar or salt solutions for that you're doing in-house. So I guess we're often looking at, things like the fecalizer, so, those ones in-house where you sort of have the little device, you put some feces in it, you put the sort of towel around it, put some of the solution in, mix it up, put the little filter in, fill it up to the top with the solution, put the cover slip on top, leave it 15 or 20 minutes, then get the cover slip off, put it on a slide, and take a look at that. I don't think it's a technique that most people enjoy. It's a little smelly, it's a little messy. The other thing to remember is that these solutions are pretty hard on your microscope as well. So you've got to make sure you clean the objectives with that. Otherwise, it's going to damage the microscope with it. And we've got to get the right concentration of solution. If the density is too low, they sink. We need to be able to get the eggs to float, but not a density that's going to sort of damage the eggs with that. So it's, the solution has to be mixed well. The accuracy is going to depend on the expertise of the person doing the test. So I know my experience in clinics has been, I don't particularly like doing fecal floats, so I will give that to one of the nurses. They might give it to the next junior nurse, and it ends up with often the most junior person in the practice because they can't say no. They don't have anyone else to pass it on to. So sometimes we have a technique that has limited capability for picking up parasites being done by the least experienced person in the practice. So that can reduce its accuracy a little more. So let me say, doing a simple fecal flotation in the clinic is certainly better than not doing any testing at all. So not trying to discourage that, but we've got techniques that can give us more. And the other challenge with this technique is, we know for the parasites that they're not, if they're in their pre-patent period, we won't see larvae, or even in a period where they could be shedding eggs, not all of them are consistently shedding eggs. So we can get false negative results as a result of that. And that's not because someone hasn't done the test well, it's just the limitation of the technique. So we can then look at, so that's a sort of passive flotation that we talk about, that you're doing in clinic. You can have what we call an active flotation, which is a flotation centrifugation technique, and that's what we do in our laboratories. So it's using a different concentration of solution and a different technique to try and we're using zinc sulfate for that. It's trying to increase the sensitivity of the technique, to give us better results with that. So, the advantage of the in-house kits are they're very inexpensive, but, we get a better sensitivity by doing the technique in the laboratory. And there's a group in the States called the Companion Animal Parasite Council. This is a group of veterinarians, parasitologists, human doctors, zoonotic disease people, medico-legal people, zoonotic experts, to get together and create recommendations for diagnosis and management of different parasites. And certainly the CAPC suggests that for flotation techniques, we're better off doing the flotation centrifugation technique with that. So this is looking at some data from a study. It was done a few years ago now, back in 2006. It was published in the compendium, and it was comparing on the same fecal samples the difference in isolation of the number of eggs recovered from a simple flotation technique at different times with the flotation, so 5 minutes, 10 minutes, 15 and 20 minutes, and comparing that to the flotation centrifugation technique. And you can see with this that there was significantly higher numbers of eggs identified using the flotation centrifugation technique with that. So we know that we're using a better technique in that setting. This is looking at some data a different way with that. And so it's looking at the rate of false negative results, so where we've missed infections with that. And you can see for hookworms, nearly 5% false negatives on the simple flotation, drop that to 1% with the flotation centrifugation. Your roundworms drop from 26 to 10. Whipworms improve significantly, and even some tapeworms like Taenia, it improved the sensitivity there too. So even though it means you've got to send the sample to the lab, it has some advantages. No one likes doing the fecal floats in clinic. They're smelly, they're messy, they can mess with your microscope. So we can send it to the laboratory to get a technique done by trained scientists, and also a technique that has higher sensitivity with it. So we're going to pick up more infections with that. So there's really nothing to lose by doing that. So, in conclusion, based on the Companion Animal Parasite Council recommendations and these studies, we can show that the centrifugation method really maximizes the number of eggs that we can recover with fecal parasitology. But now we've got ways that we can try and give you more information with that. So, beyond that zinc sulfate centrifugation with, a trained scientist having a look at that, there are now antigen techniques. So rather than looking for larvae in the feces, we are looking for antigen coming from the adult parasite to detect in the feces, and to try and improve both the sensitivity and the specificity with that. And it's an antigen test that's an ELISA test, so enzyme-linked immunosorbent assay. So it's a good quality technique for that. So it has a number of advantages. So first of all, even with a single-sex infection, you can get positives. We're also going to pick up things significantly sooner, because once there are adults there, even if it's in the pre-patent period when they're not producing larvae, we're going to be able to detect the infection. And also for some of the agents that have intermittent shedding of larvae, this is a much better technique, to try and make that diagnosis. So the Companion Animal Parasite Council have given some recommendations on these. They say that, if we start with hookworms, that if you're doing, the more routine parasitology, we're better off doing the flotation with centrifugation. But they also suggest that, really the commercial ELISA assays are going to give us an extra layer of information with that, because they're not linked to egg production. They looked at it for roundworms as well, again suggested the flotation centrifugation technique if you're doing routine parasitology, but again, antigen tests will increase the sensitivity of testing. And surprise, surprise, they say the same for hookworms. So, do the flotation centrifugation, but also the antigen test gives us a lot more information. And the other thing, as I say, if we are doing the flotation centrifugation, having trained scientists do it has value as well. I know over the years when I've had patients with diarrhea and you're looking at that fecal float and you're like, oh, you're trying to convince yourself that there's something there. And other things like, pollens or grain mite ova, can look like some parasites. Even in some cases, parasites may just be passing through. So, for example, a dog that's gotten into a cat's litter tray, it may have feline roundworm eggs passing through its gut, but they're just a passenger, on the way through. They're not actually causing an infection. So, it really is a win-win situation. By sending the fecal samples to the lab, you are getting that nasty sample out of the clinic. Your staff will be happy with you for that. And we're getting better quality results for your pet owners. So everybody wins with that. So looking at what we're doing in the lab now, this is looking at the outcomes of the fecal antigen testing. So we can see with that, with hookworms, we're significantly increasing the sensitivity of the test. So more than doubling sensitivity by combining the fecal antigen testing with the ova and parasite testing over doing the ova and parasite testing alone. Roundworms, we're increasing it probably by at least 50% with that. Roundworms tend to be more prolific egg shedders, so the ova and parasite testing will sometimes give us the result with that. But we can still improve it further with the antigen testing, and you can see with whipworms it makes a really significant difference with that, because one of the challenges with whipworms is they can be so intermittent with their shedding of eggs that it really makes a big difference by detecting the adult worms. This is out of a published paper looking at sort of the ova and parasite testing versus the antigen testing, showing the difference in time for when tests can be show up positive in infected animals. And this is looking at whipworms. So in this study, the first time you could detect larvae in the feces was at day 69 after infection, whereas the antigen test was showing up positive at day 31, so significantly sooner. And we know that whipworms can cause, GI disease, they can cause anemia and things like that. So, excuse me. So by being able to detect those nearly 40 days earlier, we're doing better by the patient with that. And by treating them sooner, we're going to minimise the risk of getting significant disease as a result of that. And whipworms can certainly do it. I know in the past I've seen patients with significant regenerative anemias, with whipworm infections. They can cause large intestinal disease. And it's nice, I must admit, my routine in the past is, before I would do a colonoscopy on a patient, even if they'd had fecal flotations, I would often treat them with fenbendazole before doing a colonoscopy, because nobody wants to diagnose whipworms on colonoscopy. But with the antigen test, we can be a lot more precise about knowing whether they've got a whipworm infection or not. Now, just looking briefly at the diarrhea PCRs here, not in any way going to go through this in any significant depth, but, having a look at the diarrhea PCRs, what are their indications? And I am not in any way, shape or form suggesting that we need to be doing a diarrhea PCR on every patient you see with diarrhea. Sometimes you'll get a patient with acute diarrhea, they're still clinically well. The chances are they probably just ate something silly and it's upset their gut. And, with symptomatic therapy, they're going to improve over a few days. Always good to do parasitology, but we maybe don't necessarily need to go as far as a PCR for that. If they've got a severe acute diarrhea, you've got a whole litter of puppies with acute diarrhea and they're getting unwell with that, the diarrhea is significantly hemorrhagic, things like that, then adding the diarrhea PCR in that setting can be useful. It certainly has a place with chronic diarrhea as well. In those patients where we're really, once it's getting chronic, we really need to work them up to find out what's causing the problem. So doing parasitology, looking for infectious causes with that, doing diet trials with them, potentially looking at, ultrasounds and endoscopies, doing a minimum database, a CBS and a chemistry to make sure we don't have a metabolic cause for the diarrhea, things like, hypoadrenocorticism or pancreatitis or things like that. But in those cases, if we're working down the list of causes, we can try and rule in or out some of the infections with that by doing a PCR. So when we look at dogs with what we include in the PCR panels, we look for some bacterial pathogens, so Campylobacters. One thing with Campylobacter on PCR compared to cultures is there are a number of Campylobacter species that are isolated at the same rate from dogs or cats with diarrhea as without diarrhea, so they may not necessarily be pathogenic. The Campylobacter coli and Campylobacter jejuni are ones that are isolated at a higher rate from patients with diarrhea than normal patients. So that's why we were including those ones in the PCR panel. So we're trying to look for the more relevant ones. Salmonella we look for there. There are particular viral agents we're looking for. So, distemper, circovirus is, if that's causing a problem, it's often hemorrhagic diarrhea. Parvo, coronavirus, I'm thinking more young animals with that. If it's an adult animal with that, it's likely not the cause of the diarrhea. We look for some protozoal things with Cryptosporidium and Giardia. And then we're looking for some of the toxin genes with Clostridium perfringens. They're ones that they're quantified. So we look for the enterotoxin, the alpha toxin, and the net EF toxins. And the net EF toxin has been more commonly found in patients with hemorrhagic diarrhea. So if you have a sort of low range result on the quant result, it's likely not significant. If it's high range, it's possible. And I must admit, I always think with Clostridia, if I get a high range result, it could be the sole cause of the diarrhea. It may still be incidental. Probably what's more likely happening is it's a reflector of underlying gut disease, and that's why the clostridial numbers have increased with that. If we look at what we do with cats, we're looking for the same bacterial species, looking for coronavirus and panleukopenia with the viral things. A few more protozoa, so we're looking for the Cryptosporidium and Giardia as we do in dogs, but also Toxoplasma and Tritrichomonas, which is going to be seen in sort of fairly specific circumstances. We're not looking for the net EF clostridial toxin, just the alpha toxin and the enterotoxin with that. I guess PCR always requires interpretation. So it needs to be interpreted in light of the patient. So as I said before, if if it's a 4 or 5 year old cat or 4 or 5 year old dog, I get a positive coronavirus, I don't get too worried about that. I'm more concerned that that could be a cause of diarrhea in a young patient. So you just need to look at the patient and say, does this result, is it likely going to be causing the signs we're seeing? As say a low-range Clostridia, I'm not going to get too concerned about. So the quantification of determining how much of that gene is there, it really looks at how many cycles of the PCR it takes to be positive. If it only takes a few cycles, it was more of the nucleic acid there to begin with, whereas if it takes more cycles, there was less of it to begin with. Also important to see that we see quite a lot of co-infections, reasonably high rates of that. So there's more than one pathogen there. Sometimes I will determine, for example, if I got Campylobacter and cryptosporidium together, I'm probably going to treat the Campylobacter first and see how we go with that. If not, if it doesn't resolve them, I might need to treat the cryptosporidium. If I had sort of Campylobacter and the Clostridia, I'm probably going to treat the Campylobacter again and see if we get that under control, whether the Clostridia settles down. So we need to interpret those in light of the patient. And if you have any questions about that, you can obviously ring our internal medicine consulting service, and one of the specialists would be happy to help you out with that interpretation. I think if we've got a patient with diarrhea significant enough to do a PCR on, we need to be doing parasitology as well. And this is a situation where I would do both the flotation centrifugation and the antigen test. So the antigen test is great to say, do they have hookworm, whipworm, roundworm or not? The flotation centrifugation gives us information as well. So if you're finding Giardia cysts in there, it tells us that, there's something a bit more active there. We might find, especially on younger animals, if we're finding things like isospora or things in there. If we're finding coccidia, that may be, which we can find on the flotation, that may be in certain patients an extra thing that we need to consider treating. So it's really important to consider adding the combination of those tests if you're running a diarrhea PCR. So just in review, fecal parasitology, I think, is really indicated any time we have a patient with diarrhea, weight loss, ill thrift, anemia, things like that. It's really important to know. We've got a number of different methodologies with it. The methodologies vary with their simplicity, their cost, and things like that. But the results you get from them also vary. So, a fecal smear or wet mount, useful for some Giardia patients. Not perfect sensitivity, but if you find it, that's great. Not finding it doesn't rule it out. A fecal float in clinic is better than doing no parasitology at all, for sure. But we've got better techniques we can do in the lab with the flotation centrifugation. We've also got the antigen profile, which takes it to the next level now. We've got the PCR. So we talked about the indications with certain acute diarrheas or chronic diarrheas, but really also important to add the parasitology with that. So I hope this has been helpful for you. If you have any questions, please don't hesitate to reach out to me. You can get me through IDEX or ring the call centre. But, I think definitely would encourage you to do more fecal parasitology and look at doing the PCR in the patients where it's indicated. So thanks for your time, and please reach out if you've got any questions.